Hi, I'm Dr. Kirshner, and I practice here in the Allentown area. I practice with an emphasis on treating patients with chronic and debilitating conditions. In this video, we are going to talk about fibromyalgia. The information in this 3-minute video may change your life forever. If you are like the vast fibromyalgia sufferers, then you know what it's like to be on the medical merry-go-round, going from family medical doctor to all the specialists. Maybe you've been referred to the psychologist because the average medical doctor believes that fibromyalgia is actually in your head. However, if you suffer from fibromyalgia, then you know that it's not all in your head. You know what it feels like to live with the constant pain. You know what it feels like to live with the constant fatigue, and you know what it feels like to feel every day is a struggle. The problem with using the term fibromyalgia is, by definition, it means pain in the muscles, as if the problem originates or is caused by a problem within the muscles. The way it is classically defined is if you have pain in 11 out of 14 specific points, then you are labeled as fibromyalgia. There is a saying in healthcare that it takes a lot of aspirin to take the pain away from an attack in a foot. Maybe you've been prescribed painkillers, muscle relaxers, anti-inflammatories, and antidepressants. Your doctors are only chasing the symptoms, and that is why you and the overwhelming majority of fibromyalgia sufferers will never, ever get better. Fibromyalgia patients can get outstanding relief if and only if they correct the underlying cause of the problem. Our office is different in the management of these conditions. What we have found is fibromyalgia is primarily a combination of both a neurologic and metabolic problem, creating the fibromyalgia pattern. Through our discovery process, we find where the attack is and handle it. Because our treatment is individually customized, until we perform our evaluations, we cannot say exactly, specifically, what is causing your problem. We evaluate neurologically, metabolically, and nutritionally. Your problem might be what we call a brain-based problem, where one side of your brain is firing slower or faster than the other side. It might be an overall metabolic inflammatory condition, which we can determine by blood work. It might be an autoimmune condition, which we can once again pick up from your blood work. It might be a nutritional problem. It might be a multiple food allergy problem. We take a functional approach to your condition. For instance, when we perform our neurologic exam, we are looking for the nuances of functional deficits. We try to determine why is it certain nerves are firing fast and other nerves are firing slow. For instance, why is it you might have different neurologic patterns sitting as opposed to standing? From the metabolic side, we also look from a functional viewpoint. Even if you've had prior blood work, we look at it from a functional viewpoint. I have had patients tell me their blood work is normal, yet many times when patients bring in their results, the blood work is incomplete. They, the professionals, have not looked at all the things I look at. A complete picture might include a hormonal panel, a GI panel. It might include an inflammatory and an autoimmune panel. It might include an allergy panel. Only and only after we find the cause or causes of your problem will we determine and design a treatment plan custom made to you. If you would like more detailed information on our approach, simply fill out the form on this page and we will send you a free 40-minute DVD that fully explains our approach. This could be your first step to living pain-free. On this page, you also have an opportunity to schedule 2 free evaluation sessions. If, after listening to this 3-minute overview, and you have made the decision that now is the time to get off the medical merry-go-round and finally take control of your life, fill out your phone number on the form below. By filling out your phone number, this will indicate to us that you want our staff to call you to set up your 2 free evaluations, 2 free appointments. Once again, if you just want the 40-minute DVD that fully explains our protocol, just fill out your name and address and leave out your phone number. If you have made the decision that you want to schedule your 2 free visits, in addition to the name and address, fill out your phone number on the form below. The question I am asked is, why the 2 free visits? Well, the first visit is where you and I go over your case, and I also collect the initial medical paperwork, and I also perform an initial screening exam. The second visit, after I've gathered your information and I've had a chance to review it, I will let you know if you qualify for care and if I will be willing to accept your case. This program is not for everyone, and I only accept cases where, 1, I know I can help, and the only way I can do that is from what we glean on the first visit, and 2, more importantly, if you are willing to make the necessary changes and actions to finally take control of your life. I thank you for your attention.